today for a rally. My name is Nancy McMurphy. I'm the president of Unifor Local 302 here in London, Ontario, and I'm a proud member of our Unifor National Executive Board. I want to start off today by offering my thanks and my appreciation for each and every member of the healthcare team that is represented. Every one of us here know that it takes a collective effort from all departments and every classification to provide the high level of service to our patients and residents that they deserve. And without all of you working together to do this, it wouldn't be possible. So thank you from the bottom of my heart for your ongoing determination and commitment. I also like to thank our national president, Brother Jerry Dias, not only for his ongoing support of the healthcare membership, but his commitment to high-quality care for all Canadians.
Right up.
Many of us here today can remember a time when job satisfaction played a very important role in our career path. But that sense of fulfillment has dissipated greatly over the last few years. We've witnessed cutbacks, staff shortages, and irresponsible government decisions that have created a climate of crisis in healthcare. For many years, we have been the strongest advocates for those that we cared for. We've demanded that they be treated with dignity, respect. We've been their voice, their ally, and the one that stood up for their rights. And now, my friends, it's time for us to demand that same level of respect for ourselves and the services that we provide. It's time for our employers and our elected government officials to recognize our ongoing dedication and the many sacrifices that each of you make every day. Healthcare workers have done their part, and for many of you, that meant a recent 2-year wage freeze. The wage freeze, coupled with rising cost of living, has caused mounting stress and worry for many of us. But let me suggest to you the same can't be said for the hospital executives or the private long-term care corporations that continue to reap millions of dollars year after year. So now it's time for us to set our new agenda. Here's what we demand. We demand respect. We demand real wage increases. It's time for us to catch up. We demand that our employers come to the bargaining table and negotiate a fair, respectful collective agreement. No more arbitration. Our members deserve the democratic opportunity to vote to ratify their collective agreement. During Debbie Matthews' years in office as Minister of Health and Long-Term Care, there were numerous scandals that resulted in misuse of millions of healthcare dollars. And yet, ironically, she's recently been named President of the Treasury Board by Premier Wynne. We've come to your doorstep today, Ms. Matthews, to tell you and to tell the rest of the government representatives that we have had enough. No more cuts to public health care. No more privatization. It's time to invest in healthcare and the frontline workers. There is no substitution for quality healthcare. It's time for the Government of Ontario to provide the necessary resources to ensure that quality of care can be delivered. We will be heard, and yes, Ms. Matthews, we will hold you accountable.